Hi, my name's Anna Chan, and today I'm going to be my name's Anna Chan. I'm a student physical therapist assistant from CBD College, and today I'm going to be going over and explaining what venous stasis ulcers are, what causes them, and I'll give you 2 interventions that you can do at home so that you can start doing them, lower your risk to getting them, and then also promote healing. So what is a venous stasis ulcer? Essentially, it's a ulcer it's like a sore on the lower leg. It's usually around the ankle area, and so technically what happens is the veins are supposed to aren't like able to return the blood correctly back up to your heart effectively, and so instead of the blood going back to your heart, the blood pools in the lower leg, and then over time it increases pressure and fluid buildup. It damages the skin and causes an open wound that heals very slow. And so some of the causes of the venous stasis ulcers is pretty much poor vein valve function. There is chronic swelling in the lower leg, and there is also poor circulation from lack of movement. So poor vein valve function is pretty much when the your veins in your legs, they pretty much have like a one-way valve that keep the blood flowing upward towards your heart. And then when the valves become weak, damaged, usually it's from age, pregnancy, family history, or previous blood clots, they essentially don't close properly, and this allows the blood to fall backwards and creates a pool in the legs, and then over time it increases the pressure, breaks down the tissue, and leads to ulcers. And then for chronic swelling in the lower legs, it's when your legs stay swollen for long periods of time. Your skin and your tissues don't get enough oxygen or nutrients, and so this makes the skin very fragile, and it's prone to breaking down, which increases the chance of an ulcer forming. And poor circulation from lack of movement. So think of the calf muscles acting like a pump. So if you sit for long periods of time, blood flow slows down and the pressure builds in the veins so the pressure builds in the veins. So without movement, the body struggles to clear the fluid, and essentially worsens the swelling and increases the risk of any ulcers forming. And some 2 interventions to help reduce the risk and also promote healing would be compression stockings. And so essentially compression stockings are very essential for treating the venous stasis ulcers. They help push the fluid back up the leg, reduce swelling, improve circulation, decrease pressure on the skin, and prevents new ulcers from forming. So some important things to mention is you just can't get any type of compression stockings. There's I believe 2 types. There's 20 to 30 mmHg or 30 to 40 mmHg stockings, depending on your doctor's recommendation. So you essentially just put them on first thing in the morning before the swelling builds. And the second intervention would be calf muscle pump exercises. And so movement helps veins push the blood back towards your heart, and so you could do these every hour. All you're going to do is you're not going to grab your foot. You're going to point your toes down, and then you're going to pull your toes up, and you're going to repeat the same thing for 20 times. And you want to do these again every hour. Also walking or standing breaks. If you sit a lot, get up and move around every hour. And if you stand a lot, make sure that you're taking seated rest breaks with your feet elevated. This stimulates circulation and reduces swelling. And then some other things is just ensure you're elevating your legs every now and then above your heart for 20 to 30 minutes to reduce swelling. Inspect your skin, and also moisturize your skin if you have really dry skin. And so venous stasis ulcers pretty much happen because of poor vein function, chronic swelling, and decreased circulation. Thank you.